appreciate so much the message, Dr. Raymond, that you have brought to our community. Now is your opportunity to dialogue with Dr. Raymond. So if you have a question, if you would just raise your hand and one of us will bring you a mic.
Dr. Amen, you mentioned children and being put to sleep before surgery. My little girl had a lot of surgeries years ago when she was 2 to 3, and I asked my wife a second ago, and she was put to sleep about 10 times during multiple surgeries. What was it that you were saying about how had anesthesia, I think, at a young age?
Yeah, it was surprising for me because, I'm also a child psychiatrist, and there was nowhere in medical school or in my training that said general anesthesia can make brains more vulnerable. And then I had a patient who was an alcoholic. I got her sober. Her brain was beautiful. And then she had knee surgery. And she called me up crying. It's like, I have Alzheimer's disease. I can't remember anything. I'm like, did you relapse? Nope. And I scanned her, and I could see how anesthesia had hurt her brain. And then I did a literature search, and anesthesiologists fight about this because they never tell you it's a risk factor. And so some of them go, oh, no, it doesn't do anything. I'm like, no, I have imaging evidence. It does. And there's a study on children who've had anesthesia have a higher incidence of learning problems, and older people have a higher incidence of dementia. Now, obviously, it doesn't mean she doesn't have the surgery, right? Because that could save her life. But it means we probably should look at her brain and then rehabilitate it. Now, how old is she now?
She's 20.
And is she great?
She has some issues every once in a while.
So maybe she's not optimal. Like what I often tell my patients is I don't take broken people and put them back together. I take awesome people and help them be more awesome. And so does she have full access to her brain? And if she doesn't, we should try to give her that. I'm actually going to put my hearing aids
So in your book, you talk about the different types of attention deficit disorder and that they're not all treated the same. So if someone goes on Adderall and it's the wrong thing for their brain, I guess my question is, how do you know which drug you need? And if you're on Adderall and it's not working for you, how do you get off?
Okay. So when I first started imaging, it was very clear to me ADD is not one thing. And over time, it's evolved into 7 different things. And you probably convinced me that it's 8. That head trauma probably should be one of the types. So if it's the right thing, you generally know. Like, I have a grandson that has ADD, and he went from mostly gonna fail 6th grade to 8th grade. He's a star and got into the private high school and so on. So you generally know. If you don't know that it's working, it's not working. So, and I have a quiz online called ADD Type Test, addtypetest.com, and it'll give you a sense which of the 7 types or combinations of the 7 types someone might have, and then I talk about, okay, what are the supplement regimens or the medicine regimens that could be most helpful. And the good thing about Adderall is it's pretty much gone the next day. And so if people stop it, it's not like most SSRIs where people can really have wicked withdrawal.
So Dr. Raymond, question for you. In my before I got here, I did a lot of work with autism. I'm wondering if you've done SPECT scans on children or adults, been diagnosed with autism spectrum disorder, knowing that, like ADHD, it's multiple conditions. It's not one thing. It's just a convenient diagnostic box. But I'm wondering what you've seen on their scans, if you've done them, and how you would manage that for those who need management, recognizing some probably don't.
It's a great question. So we've done probably 3,000 kids with autism, published a study on 1,000 of them with my colleagues from USC, and it's not one thing, but there's a classic pattern. So like there's a classic pattern with ADD and bipolar disorder and OCD, the classic pattern with autism, decreased activity in the cerebellum, especially the cerebellar vermis, which is in the medial part of the cerebellum. In fact, I coined the term the dumbbell sign because it looks just like a 10-pound dumbbell where, you know, the cerebellar hemispheres are okay, but it's like missing that part in the middle. And I think that's one of the reasons that processing is slow and coordination is not as good as it could be. And their frontal lobes are hyperactive, especially the anterior cingulate gyrus, but also the lateral frontal lobes. And when we published, right, I mean, I talked about when you lump a lot of people together, it doesn't tell you anything about individual patients. But when we lumped a lot of people together, frontal lobes overactive, the posterior hemisphere underactive, especially the cerebellum. But then we have this very interesting group of ring of fire where too much activity, and we think that's an inflammatory process in the brain. But then this other very unusual group called a half ring of fire, and it's generally the non-dominant hemisphere is just working way too hard. And one of the reasons I got so interested in diet and psychiatry is I had an autistic patient, it was like 1993. Mom told me she stopped gluten and dairy, and the next week he had 50 words, and because he was nonverbal. And then I'm like, well, why is that? Gluten in your stomach mixes with stomach acid and creates something called gluteomorphins, works on the opiate centers in the brain. Dairy, casein, protein in dairy, mixes with stomach acid and creates something called caseomorphins. And again, works on the opiate centers of the brain. And so for many of my patients, if the parents can handle the fallout, it's like, let's just try an elimination diet for a month. And if it doesn't do anything, okay, it doesn't do anything. But you'd be shocked at the number of times parents do that. We get improvement. And then, not for all autistic kids, but for ones that have low activity, because that's one of the subtypes, hyperbaric oxygen therapy can be miraculous for them. So that's what we see.
What have you seen with women in perimenopause or menopause, and has there been any differences between African American women and other ethnicities?
So, I have 5 sisters. Five daughters. God just thought it was hysterical. I've thought a lot about perimenopause, menopause, PMS, and why do your hormones drop with age? Does anybody know? It's the planet's way of getting rid of you. And I'm sort of not okay with the whole thing. So when estrogen goes low, activity in an interesting part of the brain called the posterior cingulate gyrus goes low as well. It's the first area that dies in Alzheimer's disease. So I'm pretty much a fan of hormone replacement for women where it makes sense. And a lot of women don't know progesterone Think of it as the brain's natural Valium, or the brain's natural anti-anxiety molecule, goes low 10 years before women go into menopause. So right around 40, 42, all of a sudden you find yourself can't sleep, more irritable, drinking more anxious. Get your progesterone level checked, because just taking 100 milligrams of progesterone, you might not need Prozac, Ambien, and Xanax. Now, you see why the pharmaceutical companies hate me, right? I just saved you a whole bunch of money. Now, for African American women, I don't know if you know, but the darker our skin, the less conversion of vitamin D in our bodies. And there is a much higher risk of low vitamin D. And so you, for sure, and anyone who has darker skin, I'm Lebanese, and if I go in the sun, I turn dark. You need to measure your vitamin D level. Healthy is between 30 and 100. People who have a level over 40 have half the risk of cancer of those who are under 20. And when I first tested my level, and I live in Southern California where the sun is out 300 days a year, my level was 17. And I'm like, I was horrified. And I was hungry all the time. You know, what they say with Ozempic is the food chatter in your head goes away. Well, when I got my vitamin D level healthy, the food chatter went away. And I ended up losing 20 pounds because I could sort of be more disciplined with my diet. But I think all of us should have our hormones tested every year, and then we should work to optimize them. And the fastest way to optimize your testosterone level is kill the sugar. Because sugar, if you go to the restaurant and have cheesecake with your honey, it drops your testosterone level 25%, which means no one is going to get dessert when you get home. You know, I hope you guys heard what I said. And it's one of the first times I've actually said it in public. To do this new way of thinking is not about money. It's about creativity. It's about thinking in a different way. It's about bothering people. And I'm friends with Mehmet Oz, who's now in charge of CMS. It's about bothering people like him about you should cover this stuff. You should reimburse it at a level where practitioners are actually going to want to do the study. It's about community coalitions like this one. And even if you never scan anyone, you can think bright minds in every mental health practice. It's like, you know, we have to work on your weight, or what's your blood sugar, or smoking is not a good thing, and alcohol is not a health food, right? We're in a war. I mean, you just have to be so clear about this. You're in a war. Last year, Anheuser-Busch spent $7.2 billion on sales and marketing. The fast food companies, $11 billion on sales and marketing. You're in a war. And who's going to lose in this war? It's our children, right? The mental health epidemic is worse than it's ever been in kids. All right. You know, with my last name, I can preach.
So I have a question. Hindsight's 20/20. So when my second husband and I got married, we had 5 children, 11, 12, 13, 14. 2 of the boys had ADHD. So we were very engaged with helping them to survive that and figuring out, you know, what was going on and how to handle it. In the meantime, I say 20/20 vision, you can't see things except looking back. I realized that my daughter was also ADD. So can you elaborate a little bit on the difference between boys and girls when there is ADD or ADHD present?
Yeah, so ADD, ADHD, it's just different eras of the same term. In 1980, when I trained, it was attention deficit disorder with or without hyperactivity. And then in 1987, they voted to change the name. And they actually messed it up because now it became ADHD. Half the people who have it are never hyperactive, and a majority of those are girls or women. And in 1994, they go, oh, we made a mistake, and they changed the name yet again to AD/HD. Like, what the hell does that mean? Half the people who have it are never hyperactive. Okay, you know, men, they can't say sorry, and most of the committee was men. They should have said sorry and went back to ADD with or without hyperactivity. Boys are diagnosed 4 times more than girls, maybe 6 times. But I think they probably have it twice as much as girls. Girls are underdiagnosed because they don't bring negative attention to themselves. And I believe there's still very serious gender bias in this country, where if a little boy is having problems, the parents are like, he's going to have to take care of a family someday. We have to get him help. If a little girl is having problems, they just sort of hope she marries somebody nice. And that's completely irrational, because if anything, for the last 3 generations, women are doing way more than men. They're primary caretakers for the house. They're primary caretakers for children. They're working outside the house. In California, it's like 93%. And so we now have 3 generations of tired women. And the ADD adult women, they get overwhelmed, they get depressed, they go to their family doctor, and they end up on Lexapro or Prozac or Zoloft, which then makes ADD worse, because in your brain you have this balancing act of serotonin and dopamine. So serotonin is a neurotransmitter that helps you be more flexible. It helps your mood be more positive. Dopamine also helps your mood to be more positive. It gives you motivation and focus. But as serotonin goes up, dopamine goes down. And as dopamine goes up, serotonin goes down. So if you don't get it right and you put somebody on Adderall, they become obsessive. But often for these ADD women, they don't have a serotonin deficiency, they have a dopamine deficiency, the ADD, thinking about it in simple terms. And so putting them on an SSRI, they're less anxious and they don't care, but they're more ADD. And now, because of the SSRI, they can't have an orgasm, so they don't want to have sex. So their husbands are very unhappy because she doesn't want him anymore, but is still not picking up the dry cleaning on time and is late. And so how I often have diagnosed ADD women is they brought their hyperactive boys to me. And then I always like go, who's got it? Right? I mean, several of my children have it, and when Caitlin, poor child, I picked on that child so much. I adopted my oldest. He has inattentive ADD. Brianne was just the easiest child on the planet. Caitlin was hyperactive from before birth. Like, she was so active inside her mother's womb, she thought she was going to be a boy. She wasn't. When I held Brianne, she and I could watch Beauty and the Beast over and over again. She'd sit in my lap. Caitlin's climbing on my head. I'm like, where are you going? When I took her to the mall, she would have been one of those children on a little yellow leash in the mall. But I wrote a column in the local newspaper where I lived, and people recognized me. Hi, Dr. Amen, why is your child on a leash? So what I used to do is put her in her stroller and tie her shoes together so she couldn't get out. And I knew, this is very important, 30% of 3-year-olds look hyperactive. Only 5 to 10% of 4-year-olds look hyperactive. So before 4, I'm going to church, I'm lighting candles at church, I'm putting extra money in the offering for her. I write to the Pope, I'm like, could you send a blessed picture? We'll put it by her bed. He didn't write back, must have had an ADD secretary. And when she was 4 years old and didn't lose the hyperactivity, took her to somebody I trusted, and the doctor basically looked at, my first wife and I and go, who has it? And I'm like, it's not me. Like, I've written 42 books and I've turned everyone in early. And she goes, oh no, not me. And then she asked her, because Robin took 12 years to do college, how do you study? She goes, oh, I could never study at home. I go inside my little car underneath the street lamp, no kids, no noise, nothing, then I can study. And getting her diagnosed explains so much of my life. And it runs in families. So if you have a girl that you go, I think she has it, then the question becomes, where did she get it, right? Come down her mom's side, come down her dad's side, because usually if it's really ADD, not ADD induced by devices, right? Because these devices are destroying dopamine in children. You see it through generations of the family, often with alcohol or problems with impulse control, so on. So how do you know if you have ADD? Well, you could get scanned, or if you have 3 of these 5, short attention span. But not for everything. It's short attention span for regular, routine, everyday things. Schoolwork, homework, paperwork, chores. The things that make life work. And it's not just like 4 days before you have your cycle. It's, I have short attention span. But it fools people because people will say, actually George Bush II said this, and I'm like, not the second ADD in a row president, because President Clinton had ADD, right? You don't get the whole Monica Lewinsky thing if you have forethought. I've been in the Oval Office. That thing's small. It's like, how did you do that? Anyways. George Bush said, oh yeah, because he got like C's in college. It's like, yeah, I can concentrate if I'm interested. That's the classic ADD mantra. So short attention span, not for everything, for regular, routine, everyday things, things that are new, novel, highly stimulating, interesting, or frightening, they can pay attention to just fine, which is why they love scary movies. And they're conflict-driven, right? Do you know these people? They play Let's Have a Problem, right? You're just having like a really good day, and they poke, and they poke. Caitlin, she used to run up to her brother, kick him. Her brother's like 10 years older, kick him, and run away laughing. And if he didn't go chase her, she would come and kick him again. She's like, let's engage. They're always handing you this rope. Let's fight. Stressful. The second one is distractibility. They see too much. They hear too much. They sense too much. They take off their clothes because they hate tags. Like right after I got married, as a second-year medical student, we had this cute little apartment in Tulsa, Oklahoma. And I walked into the closet and picked up a shirt. And someone had cut the tag out of the shirt. And I was sort of offended. And I looked at all my shirts. The tags were all cut out. And I took one of them into the living room. I'm like, do you know who violated my shirts? She goes, don't you hate tags? I just hate tags. I'm like, I've never felt a tag in my life. Please don't cut up my clothes. I sort of knew it wasn't going to go in the good direction. So they're easily distracted. They see too much. much here, too much field, too much. They struggle with organization, rooms, desks, book bags, space. And the type who have type 3, overfocused ADD, the house can be spotless, but if you open their closet, stuff falls on you. So they have these islands of organization, and they're late, and they don't get ready to go until in their head they go, oh my God, I'm late. And so they're like always right on time or 5 or 10 minutes late, and they spend a lot of time apologizing. So organization is a problem. Procrastination is 4. They wait till the last minute to get stuff done. And they don't do it until somebody's pissed off at them. And so they spend a lot of time pissing people off. Not consciously. They don't know they're doing that. And then 5 is they struggle with impulse control. They say things they shouldn't say. They do things they shouldn't do, and they end up with a lot of sorrow and regret. And if you don't diagnose it before 9, they have long-term self-esteem problems, because it's like, I'm not smart, even though they might be very smart.
Okay, so I definitely do have ADD, but my question is, what is the best place, I will just write down, where's the best place for me to look for a basic framework daily schedule for myself, or just, I'll just say anyone who has ADD/depression, because like right now, you know, it is a hot topic of, you know, there's apps everywhere or books. That's overwhelming. So did that make any sense? Let me say it again.
You did, actually, in my
Okay.
book, Healing ADD.
Okay.
It's a big book.
So I need to get
And
that book?
I went,
don't
I
have
know you're not going to, I opened the book with, I know you're not going to read this book.
Yeah, I'll read the
Just read the first 5 pages. And you know, one of my favorite things is helping my ADD patients get an ADD coach to help them with organization. They're actually there's ADD coaching organizations, and they would be up on what's the latest app and something to organize you. And if you took ADD type tests, there's actually a subtype called limbic ADD. It's where depression and ADD sort of bond with each other. And, you know, I love, from a supplement standpoint, SAMe, like 800 milligrams twice a day of SAMe with betaine, B-E-T-A-I-N-E, 1,000 milligrams, and peak energy. So that would be my supplement cocktail for limbic ADD. SAMe has been shown to be a good treatment for depression. It's a brand new study out on SAMe, S-A-M, little e, so capital S, capital A, capital M, little e, SAMe. Start with 400 milligrams twice a day, and after a week or 2, go to 800 milligrams. If you have bipolar disorder, disregard anything I said. But I'm assuming by now you would know if you had bipolar disorder.
And this is personal, but do Adderall and Effexor work against each other, or?
No, that's actually not a bad combination.
Okay, well, that's.
Not a bad combination. And what I wrote a book in 1994 called Healing the Chaos Within, about children and grandchildren of alcoholics, and how the combination of Prozac and Ritalin was miraculous for them. And so it depends on your brain, right? But I just found for the 30 million children and grandchildren of alcoholics, if you have a big alcohol history in your family, it's often due to lower serotonin and dopamine. Prozac raises serotonin, Ritalin raises dopamine. Perhaps now I would use Peak Energy and Happy Saffron, because that does the same thing from a supplement standpoint.
Dr. Amen, I know you said it's not about money, but about creativity, but this is a money question from my cousin who's a nurse practitioner, and she wanted to know what the scope of symptoms are other than TBI that would pay for a SPECT scan to establish medical necessity. And I really want to know if we're looking at root cause things, can we push some of those things to become things that would establish medical necessity? How can we get this paid for? Or are there other ways for us to do that?
You know, I don't think we should have the money conversation until we get the people on board. It's like, do you ever think cardiologists would not revolt if they couldn't image the heart? They would like be picketing. They would be so unhappy. But psychiatrists are just like, no, we don't do that. Until they like get serious about, we need to do this. And I know, like, Mehmet, Dr. Oz would go, well, what does the FDA say? And if I got the American Psychiatric Association on my side, they go, well, you have to do this. If you don't look, you don't know, right? So it's political, and I think groups like this can apply pressure, right? And I was talking to Gary about, you know, Florence should be a center of excellence, right? You have excellent people who've suffered greatly for mental health care that's not as good as it could be. I think that's how it's going to work. But I absolutely don't believe it's the money. It's like, I'm like one person. I wasn't born wealthy. I decided how to figure out how to put it in my clinic, and now I have more because I'm creative, and I have to do it, right? If I don't do it, I won't be as effective, and I'll feel ashamed of myself. So that's why I'm here, right? Why I came, because I want to create revolutionaries. So what do you put on the insurance form? Traumatic brain injury. You describe it, and you basically, what I get covered, when the insurance companies will cover, is frontal or temporal lobe dysfunction. So it's got its own ICD-10 code. And all psychiatric diagnoses say you can't give them this psychiatric diagnosis if there's a medical problem that's causing it. And I'm like, oh, that means I don't believe in psychiatric diagnoses, because most of them are caused by medical problems, right? This divorce between neurology and psychiatry, neurologists got the brain, psychiatrists got the mind, we lost. I mean, I think we should train your mind after your brain is healthy. What a thought.
Dr. Almond, we're seeing an increase of students in our school system with selective mutism. The parents are at a loss, as well as the clinicians. And so what would you advise us to do? Because there's not a lot of practitioners that treat selective mutism. What would you advise for a child that's dealing with that?
Say it again, I'm having
Selective mutism.
selective mutism.
Yes, we have an increase of children that are suffering from selective mutism, a lack of practitioners, and parents are kind of like at a loss as well.
I'm trying to think of the cases that I have had, and I've not had many. So I wish I had a better, what I've often seen is decreased activity in Broca's area. So Broca's area is your left prefrontal cortex, so the outside of your left prefrontal, that's the language area. And if there's somehow a disconnection between the basal ganglia, which is involved in motor control, and that area, that perhaps TMS could be helpful, transcranial magnetic stimulation, or in some cases, hyperbaric oxygen has been helpful just to get more blood flow, more activity to that specific area. I wish I had more cases and I could be more helpful too. Thomas, I remember Thomas's name.
So This is kind of a two-part question. The first one is, you talked about nutrient deficiency and how it relates to brain health, and I'm curious, you've talked about what foods we should avoid, but what should we be looking at bringing into the body, / what should we be cooking in? And the second part of the question is, you say we're deficient in vitamin D, and you talked about sunscreen earlier in the talk, and I want to just hear you elaborate more on that and why that could potentially be harmful.
So why has skin cancer gone up when we are bathed in sunscreen? Because the toxins in the sunscreen increase cancer. And, you know, was it Johnson & Johnson got sued for a whole bunch of money on baby powder, and Monsanto's constantly being sued because of the toxins in food. It's, we were made in the sun, or we evolved in the sun, and not getting enough sun is clearly bad for you. Now, too much, you have to be careful and thoughtful, and I wear a hat when I go walking. But I try to get 20 minutes of sun on my body every day. And I take 5,000 units of vitamin D every day. And my level is 80, and I like that. And I just argue, know your level. Can't change what you don't measure. And so if you knew that on all of your patients, well, that's not hard, right? It's a blood test, it's covered by insurance, and one of the Bright Minds risk factors you have. What should you eat? Colorful things, healthy fat, and high protein. Now, it's a little bit different for your brain type. I heard Lynn this morning talked about our brain health assessment. It's completely free. Are you balanced, impulsive, compulsive, sad, or anxious, or some combination of impulsive, compulsive, sad, or anxious? If you're impulsive, you actually do really well on a paleo or ketogenic diet, on a low carbohydrate diet. If you're compulsive and you go on that diet, you become mean. And could you imagine, the diet book you choose to pick up can cause you to be divorced because you don't know what I know. And it's like, oh, ketogenic diet, I'll lose all this weight. I was on the Rachel Ray show once, and she said she had that over-focused brain, and when she went on a ketogenic diet, she was so mean, she wondered why her husband didn't leave her. That's like so crazy. So if you have that brain, then healthy carbohydrates, and nobody loses with plants, right? Colorful fruits, although with berries, you really want them to be organic. I should have asked ahead of time, because non-organic berries hold more pesticides than almost any other fruit. So I start every day with 3 eggs, and poached eggs, you don't have to use oil. It's awesome. I like poached eggs, and they like me back. That's the question, right? The one question you have, do I love it, and does it love me? And usually also have a shake. I own BrainMD, so I put Bright Minds powder in it. It's multiple vitamin brain boost, smart mushrooms, it's a mushroom blend, smart collagen, smart creatine. And we make a really healthy, clean protein powder. So mid-morning, usually have a shake, have a salad and some protein for lunch, and an apple maybe with almond butter for a snack. And I'm always thinking, good for my brain, bad for it. You ask a really important question. What do you cook it in? Because seed oils are pro-inflammatory. What did I say in the general session? Inflammation is a major cause of psychiatric illness, and probably most hospitals are cooking their food in canola oil. So they're just creating business for themselves. I don't like that. I don't like that. So olive oil at room temperature, avocado oil to cook with, or coconut oil to cook with. Yeah, it's not hard. The hard thing, what's the hard thing? I treated this one patient, and I was getting nowhere, and I hate that. When I was a child psychiatry fellow, Jack McDermott was my supervisor. He was a big deal in the child psychiatry circuits, and I loved him. But his evaluation of me at the end of 2 years, he said, Dr. Raymond is very smart, very kind, he's going to be a great doctor, but he has one big flaw. He writes this in my evaluation. He wants people to get better fast. And it's true. And I'm like failing with this guy. And he finally told me why. He said, I want what I want when I want it. I'm like, you're 4-year-olds in charge in your head. You want to feel bad when you do the wrong thing, not when you do the right thing. And that's what we ended up working on. What do you really want? And disciplining your inner child, right? When you have a tantrum to like have the second beer, or heck, the first beer, or the ice cream, or the cake, or the donut, that's when you should feel bad. It's, I want to create cognitive dissonance for when you do the wrong thing. Too many people have cognitive dissonance when they do the right thing. It's like, oh, I don't want to deprive myself. It's like, but what are you really depriving yourself of when you do the wrong thing? Longevity, clarity, energy, memory, focus. I have this professor I work with, I love, BJ Fogg. He wrote a great book called Tiny Habits. It's how people change. And he said, people don't change like overnight. They change by doing small, incremental steps, tiny habits. And so he and I worked together for 6 years. And then a year later, we're at a conference together. We're both speaking there. And he goes, I have to thank you. I'm like, that's awesome. Why? He said, I wake up 100% every day because of you. Why? He said, I stopped drinking. He said, I was one of those believers in moderation. And I think if you go everything in moderation, that's your gateway thought to hell. Because as soon as you say that, you're going to cheat. As soon as you say, oh, everything in moderation, means you're going to do the wrong thing for you. I'm not a fan of moderation. I mean, it used to be like 80-20, and then I'm like, no, that's way too many bad decisions. How about 95-5? And then I'm like, okay, 95-5. Only if you love yourself and your children, because guess what? Every day you're modeling health or you're modeling illness. See, I can be a real bummer sometimes. But you know, when you understand the world that I do, it's not about me. It's about generations of me. And then if you understand epigenetics, when little girls are born, they're born with all of the eggs in their ovaries they will ever have. And what happens to them in life, you had training on ACE scores, but also what they eat and what they drink and what they think. Oops. Sorry. How do you get spam in here? That's a great song for me though, right? So epigenetics, whatever you experience turns on or off certain genes in your ovaries that affect generations of people. So you using marijuana in adolescence, that's going to have a negative impact on your babies. Nobody teaches kids this stuff. I mean, I think epigenetics should be something we start talking about in 5th grade. Right? We should be talking about brain health in kindergarten. The problem with it when we do our class, kids go home to mom and dad, why are you drinking? Do you know that's not good for you? Why are you smoking? And so we have to, before we start the programs, we often have to get the parents in and go, we're going to teach kids to love and care for their brains. They may say something at home.
I didn't want to stand up. I am an integrative health practitioner, and I am a postpartum mom of 7 kids. I had my last baby a little over a year ago. I still consider myself in postpartum, but I work with a lot of postpartum women. And over my years and motherhood myself, I've just seen so many women go to get help and to ask for help with their mood and different things like that, and kind of be pushed to the side or put on something to numb them out and not to actually progress and heal. And I was just wondering if you would share what you've seen has made the most impact on postpartum moms in their first year postpartum with their brain health and healing.
It's a great question. And I think the first thing is to know their important health numbers and to go, so how's your thyroid, and how's your progesterone, and how are your estrogen levels, and how are your habits, and are you sleeping? Because you said you have 7. God bless you. I'm one of 7, and I think of my mother's, I still have her, she's a miracle, right? How she tolerated all of us without killing any of us it's just a miracle. I also want to know their omega-3 fatty acid index, because often it's super low, and getting that balanced. And I'm a huge fan of how much of it is perhaps genetic. You have a family history of postpartum depression. How much of it is environmental? Looking at, again, all the bright minds. We were in my talk where I talked about the 11 risk factors. It's like we go after each one. And then I'm a huge fan of saffron. I make something called Happy Saffron. And I'm so excited because I made it because I knew some of the research with zinc and curcumins. Brand new study out like 3 weeks ago, looking at 192 studies on 17,000 people on what are the natural things that actually work for depression. Saffron was number 1. And when you added zinc and curcumins to antidepressants, especially zinc, dramatic improvement. And so if you have women on antidepressants, so the first thing I do is add zinc and curcumins to get them to work better. In fact, I'd probably add Happy Saffron because there's no contraindication to adding saffron and zinc and curcumins to antidepressants. And then I would think of slowly tapering them to see if in fact they need them. But doing the other things as well, because part of the rise in postpartum depression is we're now in our 3rd generation of tired women. Because, I mean, well, you're working and you have a large family. So many women just feel completely overwhelmed. And then I would also look to see if they have ADD, because untreated ADD goes with way more depression, because you're chronically negative and you're chronically overwhelmed. The other thing I would do, and I didn't talk about this as much as I wanted to today, is I'd talk about positivity bias training. Because their mind, when you get depressed, it defaults to what's wrong, defaults to what's wrong, defaults to what's wrong. And you have to train it to look for what's right. And the best exercise to do it is, and I said this quickly, but not flippantly. When you go to bed at night, meditate on what went well today. In fact, what I do is I say a prayer, and then I start at the beginning of my day, and I look hour by hour, little OCD, but hour by hour, what did I like about today? And I'm like blown away every night at how cool my days are, but I didn't pay attention to it because I'm busy. So training them, that has been studied, that one exercise increases happiness in as little as 3 weeks. So you have to do it over time, right? So often people want, oh, you know, I did that for 2 nights and it didn't work, so I'm not doing it anymore, right? We have to train our mind to help us rather than hurt us.
I think we're at that point where we have to let him go, but join me in thanking Dr. Amon. We appreciate you so very much.